Hello and welcome to Weekend Talk. I'm Todd Wood filling in for Christy Knight, and our guest today is Dr. Zudans from the Florida Eye Institute and one of his patients, Mrs. Karen Hall. Thank you both for joining us today.
Thanks a lot, Todd.
And Dr. Zudans, we have kind of a breakthrough as far as eye surgery goes, I guess, right? With cataract surgery.
That's right.
And it's a great breakthrough for you and your patients. And if you would explain it to our viewers briefly.
Briefly, this is a lens replacement that's used at the time of cataract surgery. Cataract surgery is the most common surgery done in the United States. It's mostly for patients in their 60s and over who are starting to lose vision from a cloudiness to the lens in their eye. And this is a lens replacement. We've been doing lens replacements for a while, but this is a new lens. It's called a Lenstec HD lens, and it has some features that are an improvement over what we've been using traditionally. This is for the average patient who's coming in, they're getting cataract surgery, but there's something new for them that's better than the older lenses, in my opinion.
And normally, what would be your average cataract surgery? What's the process, and how does this compare to that?
Well, I brought my patient so that
we're going to let her talk about with first-hand knowledge.
Yeah, I mean, it's better to hear from a patient what it's like to go through a surgery. And
Ms. Hall, what was your experience?
Well, I went in for my yearly exam, and Dr. Zudans told me that I had cataracts and that he wouldn't be able to fix my vision any better than, I think it was 2060 or 2030 or something like that. I don't know. Anyway, it wasn't 2020. And he said that my cataracts had gotten to where that they need to have something done with them. And you know, I'm not one of the spur of the moment people, but it was like, it just sounded really good, and I trusted Dr. Zudans. I'd been going to him for several years. So I said, okay. And I had a wedding coming up. My daughter was getting married. Actually, she just got married last week. And I said, can we do this? And I can still go on the cruise, you know? And he said, sure. So we did the first eye. And I had been wearing, for 10 years, contacts so that I would see far with my right eye and near with my left eye. But as time had gone on, it wasn't very good, and I was wearing reading glasses again.
Right.
So after examining me, he said that I could do that with these new lenses. So that's what we did. I did one week, and then the next week his wonderful man came and picked me up and took me. And I obeyed everything. I went home and I rested. I put the eye drops in like I was told to do. And it was the most amazing thing in this world. Like the next day I woke up after this eye, I thought, oh my gosh, there are leaves on the trees way up. I was totally amazed. And then when I had my other eye, I mean, I can read. And, you know, going on the cruise, I didn't have to take numerous glasses, you know, to see near and far and all that. And I was able to go in the pool, and it's so freeing. I am in my 60s, really into my 60s. And it is so amazing after all these years to be able to see like this. My first time that I even knew I needed glasses, I was in 4th grade. I was at a drive-in theater, and there was message coming up on the screen like, you know, Once Upon a Time.
Yeah.
And I said, what does that say? And my father said, what do you mean? You can't read it? I said, I can't see it. So I had never really been able to see as well as I have now. And it's seriously, it's like a miracle. And I told him the day after he called me to make sure I was doing okay. And I said, it is like this eye is looking through a negative lens, a negative, you know, the old kind of negative, where this eye I can see bright and blue. I mean, it's truly amazing. And I'm so glad I did this.
A lot of people, as they get older, they get set in their ways and they just decide not to change for whatever reason. Would you recommend this to people that are approaching that age and that this is an option for them? What's your recommendation?
Okay, I have a little problem with the word older.
Me too, I'm with you.
You know, I mean, it's like I'm going to go down with my heels dragging into the ground and say that it's been a wonderful ride.
Yeah.
You know, at whatever age, I thought I was really young for cataracts.
Yes.
But it is what it is, and it is amazing. It has freed me up so much, and it makes me feel pretty to be able to not have to wear glasses after all these years.
That's great.
Excellent. That's excellent. That's a great story, and so you definitely recommend it. And what was the time frame, where the procedure and that type of thing, your recovery, any issues like that? I mean, I'm sure that's what a lot of people are concerned with.
Well, I like I said, we did it rather rapidly because I had this big trip I was planning on the cruise ship. And I went in like maybe 10 days after he saw me, had my first one done, and within a week I was ready to do my next one. But I think because I missed an appointment, we had to wait 2 weeks now that I'm thinking about it. But within a month, I was actually within a week for my right eye, I was seeing great, and then within a couple weeks, my other eye was seeing great.
And it's safer. You're driving. I mean, you don't have to carry all these glasses
No.
with you. You feel better about yourself. I mean, it seems like a win-win all the way across
It
the
is,
board.
and it's one less thing to remember. I don't have to remember, reading glasses anymore, so it's amazing. I can't tell you how much I am so pleased with this.
Dr. Zudans, I mean, this has to make you feel good to have one of your patients to have this kind of an impact on someone's life. I mean, it has to make you feel great.
I love my job. It's fun to go to work. I like doing the surgery, but I also like seeing the patients the day after the surgery and 2 weeks later when they're done with all their healing and everything. And it is very enjoyable. It's very rewarding to do something where you can help people to see better.
Right.
And I like it. I can't complain.
And this technology, it's just really, it's so beneficial to your patients. And it's got to, like, when you examine someone and you see that they're, a patient that can use this type of surgery and it's going to benefit them. I mean, like the before and when you're diagnosing someone, are you like, I can't wait to see their face when they come out of surgery and hear what they have to say?
Right. And I try not to overpromise and build up expectations really high, because it makes it actually even more fun when they come back and they're really
Right.
seeing great and they're like shocked at how much their difference in vision is. And what Karen described with when you have one eye done but not the other eye done, you sit there and you compare the two eyes, and it's like looking, one eye is white and the other eye, patients tell me
it's through a negative, the old negative, the strip negatives when
Yes.
you used to get, that's the way it looked. I thought, I cannot believe, but over the years.
That other appointment probably couldn't come soon enough.
No, it could not. It could not. And the other thing I wanted to say too was that the calls that I got, not only from Dr. Zudans to make sure I was okay, because I am by myself, and then the nurses to call me, it was really nice for them to check up on me, and I really appreciated that.
We do have a lot of patients who are by themselves, and they sometimes worry about going through a surgery like cataract surgery.
Sure.
One of the things we have a van, a courtesy van that will go and pick the patient up on the day of their surgery and drive them home, because you do get some sedation on the day of the surgery. This is all outpatient. You're only in the office for about 2 hours on the day of the surgery.
Incredible.
And the surgery itself is relatively short. It's around 10 minutes for the procedure. But patients go home, and we have lots of patients who take care of themselves at home, and so it is a very convenient thing to go through for patients.
So a couple of hours and you change a person's life. So it's a very beneficial procedure. We thank both of you, Dr. Zudans and also Karen Hall. Thank you very much for sharing your story, and keep up the great work. It really sounds like you're changing some people's lives for the better. So Dr. Zudans, Florida Eye Institute, thank you very much for joining us.
Thanks.
Thank you.
Congratulations, Karen.
Thank you.
You're
Thanks.
welcome. You're welcome. And thank you for tuning in. We will return with Weekend Talk right after this.